All right, we're diving deep today, and you guys asked for this one. We're going to be talking about ulcers.
Yeah.
We've got an awesome episode here from Medical Talks with MedExpert TV called Understanding Ulcers, Types, Causes, Prevention, and Treatment. So we're going to be talking about all of those things.
Absolutely.
And yeah, I'm ready to kind of get past the surface level stuff and really dive in.
Okay, great.
So when we think about ulcers, I think a lot of people immediately go to their stomach.
Right.
Like, oh, I have an ulcer. I must have a stomach ulcer, but you're telling me it's not always the case.
Yeah, that's one of the biggest misconceptions is that ulcers are just in the stomach, but really they can happen in a lot of different places in the body. It's kind of a hidden world of issues.
So let's get into that then. What's the clinical definition of an ulcer? Because I'm honestly picturing like a big hole.
Yeah, so really an ulcer is a sore and it's inside the body. So the lining of an organ or the skin gets damaged and it can't heal properly. It's kind of like an internal wound that just won't close up.
So it's a persistent sore more than a gaping hole.
Exactly.
So it can happen in various places. You said, what are the most common types of ulcers we might encounter?
So the most common that we see are going to be those stomach ulcers, also called peptic ulcers.
Okay.
Mouth ulcers, we all know those as canker sores.
Yeah.
And then leg and foot ulcers.
Leg ulcers. Interesting. I don't think I've ever heard of a leg ulcer before.
Yeah, it's kind of a different category because most people, when they think of ulcers, they think of internal things. But really, skin damage can cause ulcers too, and especially on the legs and feet where you might have poor circulation, and healing can be difficult. That's where we see a lot of those ulcers.
Okay, so we've got internal, we've got external. Is there a common thread that links these different types together? Like what causes the damage in the first place?
Well, the causes are going to differ depending on what type of ulcer we're talking about.
Gotcha.
So for those stomach ulcers, the most common causes are going to be bacteria called H. pylori.
H. pylori, okay.
Or overuse of some of those common painkillers like aspirin.
Really? Painkillers? Like that seems pretty harmless.
It can be if you're using them occasionally, but when you're chronically using them, they can irritate the stomach lining and make it more susceptible to damage, and that's when those ulcers can form.
So you kind of have to balance that pain relief with the potential stomach issues.
Exactly.
What about mouth ulcers? I feel like those always pop up at the worst possible time.
I know, right? And those ones can be caused by a variety of things: stress, spicy food, if you accidentally bite your cheek.
Wait, stress can cause mouth ulcers?
It can. It sounds strange, but stress really affects your immune system. And when you're stressed, your body's defenses are lowered and you're more susceptible to things like those canker sores.
So it's like mind and body totally connected.
Exactly.
Okay, so we've got bacteria, medication, stress. What about those leg ulcers? Is that stress too?
Usually not. No leg ulcers are usually a result of underlying conditions like diabetes or poor circulation. We talked about that earlier. And so because the body can't heal as effectively, those wounds don't heal properly, and then you're more likely to get an ulcer.
So it's not just what's happening on the surface, but really the health of the entire body that contributes to those ulcers.
Absolutely. And that's why understanding the cause is really important for both preventing and treating ulcers.
Oh, okay.
It's because you have to treat that underlying cause.
Makes sense.
Yeah.
Okay, so we've got these different types, and it sounds like anything from stress to chronic conditions can cause ulcers. Is there anything else that might surprise us when it comes to causes?
Oh, absolutely. One factor that's often overlooked is genetics. So while lifestyle plays a huge part, there is some research to suggest that certain individuals may be genetically predisposed to developing ulcers.
So even if you're doing everything right, you might still be more susceptible.
Yeah, it's not a guarantee, but it highlights the complex interplay between genes and our environment. It's kind of like having a weaker spot in your armor. You might need to be extra diligent about those healthy habits.
It's not just about grandma's blue eyes then, huh?
Right, exactly. It's about understanding those predispositions and working with them. And speaking of things that might surprise you, did you know that certain medications, beyond just those over-the-counter painkillers we talked about, can also contribute to ulcers?
Really? Which ones? I mean, it's not just popping a pill and hoping for the best.
No, definitely not. We know overuse of those painkillers like aspirin can be a culprit, but there are others as well. Things like corticosteroids or even some antidepressants can increase your risk.
So it's not just the type of medication, but how often and for how long you're using them.
Precisely. It's about finding that balance between managing the condition and minimizing potential side effects. And that's why open communication with your doctor is so important.
I see the connection. It's about being informed and proactive. Now, earlier we touched on the gut microbiome and its link to overall health. Does that play a role in ulcers as well?
It does. It's an area of ongoing research. But the gut microbiome definitely seems to be a key player. When there are imbalances in that ecosystem, for example, an overgrowth of certain harmful bacteria, it can disrupt the delicate balance of the digestive system and make you more prone to ulcers.
Wow, so those tiny organisms living inside us can have a huge impact.
It really can. And that's why this understanding of the gut microbiome is leading to new approaches in ulcer prevention and treatment. Have you heard about probiotics and prebiotics?
Oh, yes. They seem to be all the rage these days. But how do they fit into the ulcer picture?
Well, think of it this way. Probiotics are like reinforcements for the good bacteria in your gut, while prebiotics are the food that helps those good bacteria flourish. By using both, we can potentially create a healthier gut environment, making it harder for those harmful bacteria to take over and cause problems.
So it's like tending a garden, making sure the good guys have what they need to thrive.
That's a great analogy. And while the research is still evolving, early studies are showing a lot of promise for probiotics and prebiotics as a complementary approach to ulcer prevention and management.
That's exciting. Are there any other promising avenues for treating ulcers that researchers are exploring?
Absolutely. One exciting area is targeted therapies that address the root cause of ulcers. For example, for those caused by H. pylori infection, researchers are working on vaccines to prevent infection in the first place.
A vaccine for ulcers. Wow, that would be incredible. Imagine preventing them from ever forming. What about for existing ulcers? Anything new on the horizon for treatment?
A lot of innovation is happening there too. Researchers are developing new drug delivery systems that can more effectively target ulcer sites and minimize side effects. For example, using nanoparticles to deliver medication directly to the ulcer rather than affecting the entire body.
That sounds much more precise and efficient. It's amazing how far medical science has come in understanding and treating ulcers.
It really is. And as research continues, we can expect even more innovative treatments and preventative measures in the years to come. But for now, the key takeaway is that ulcers, while common and sometimes painful, are manageable conditions with a range of treatment options available.
And by staying informed about the latest research and, of course, embracing those healthy lifestyle habits, we can really take control of our health and well-being.
Absolutely. Knowledge is power. The more we understand about our bodies, the better choices we can make.
Well, this has been a fascinating deep dive into the world of ulcers. We've gone from the basics to some pretty cutting-edge research.
It's been a pleasure exploring this topic with you.
And for you listening, remember that this is just a starting point. There's always more to learn and discover, so stay curious and keep exploring. But most importantly, if you have any concerns about your health, don't hesitate to reach out to a healthcare professional. They can provide personalized guidance and help you navigate your own health journey. So, we've covered a lot of ground here, types of ulcers, the causes, and even some really cool new treatments that are being developed. But I want to shift gears a little bit here. What can our listener actually do to manage or even better prevent ulcers?
Yeah, that's a great question. And we've kind of sprinkled in some lifestyle tips, but it's worth highlighting some key strategies that can make a real difference in your life.
Okay, so let's break it down. Where should we start?
Well, as with a lot of health issues, diet plays a huge role. We know certain foods can really irritate that stomach lining and contribute to those ulcers forming, while others can actually promote healing and kind of soothe the digestive tract.
So making smart choices about what we eat, what should we load up on, and what should we try to avoid?
Okay, so if you're prone to those stomach ulcers, it's best to avoid things that we know aggravate the stomach lining. So things like spicy foods, acidic fruits and juices, processed meats, excessive caffeine, or alcohol.
Right, kind of the usual suspects when it comes to stomach upset. What about foods that can actually help heal ulcers?
Yeah, there are a bunch. And fiber-rich foods are fantastic. So whole grains, fruits, vegetables, not only do they help regulate digestion, but they also promote a healthy gut microbiome, which we were talking about.
Ah, yes, the gut microbiome, it's like a whole world living inside of us. So eating a fiber-rich diet is basically like feeding those good bacteria and keeping everything balanced. What else can we do for those little guys?
Fermented foods are another good option. Things like yogurt, kefir, sauerkraut, they're packed with probiotics, which are live bacteria that can help restore that healthy balance in your gut.
I love fermented foods. They add so much flavor to food. Now, we can't talk about ulcers without mentioning stress. We know it's a trigger for mouth ulcers, but does it affect other types of ulcers too?
Oh, absolutely. Stress management is so crucial for overall health and definitely impacts ulcers when we're stressed. Our body produces more cortisol, which can actually delay healing and make us more susceptible to inflammation. So finding those healthy ways to cope is key.
What are some of the things that you recommend to your patients to deal with stress?
It really depends on the person. Some people find relief through deep breathing exercises or meditation, yoga. Other people find that unwinding with a creative hobby or spending time in nature helps them de-stress. So it's all about finding what works for you and making it a regular part of your routine.
Finding that calm in the chaos of life. Now, we talked earlier about over-the-counter painkillers and how they can irritate the stomach. Any advice for using them safely?
It's all about moderation and being mindful. Use them sparingly and only when needed. If you are dealing with chronic pain and need to take painkillers regularly, talk to your doctor about alternatives or ways that you can protect your stomach lining.
Yeah.
Good advice. It's always better to be safe than sorry, especially with medication. What about managing leg ulcers? Any specific tips for those?
For leg ulcers, wound care is really important, so keeping the area clean and properly dressed is essential. Your doctor might also recommend compression therapy to improve blood flow to the area and help speed up that healing process. And of course, if you have diabetes, managing your blood sugar is crucial because uncontrolled diabetes can really hinder wound healing.
So, managing leg ulcers is often a team effort, addressing both the wound itself and any underlying condition that might be contributing.
Exactly. It's about looking at the whole picture and working with your healthcare provider to figure out that personalized plan.
Well, this has been an incredibly informative deep dive. It's amazing how much we've learned about ulcers and how to approach them.
It's been great sharing this information with you.
And for those of you listening out there, remember that this is just a starting point. There's always more to learn, and research is constantly evolving.
This is not a substitute for personalized medical advice. So if you have any concerns about your health, please reach out to a healthcare professional. They're the best resource for diagnosis, treatment, and ongoing management.
I couldn't agree more.
Well, we've reached the end of our deep dive into the world of ulcers. We hope you found it insightful and helpful.
It's been a great journey.
And remember, knowledge is power. By staying informed and taking those proactive steps, you can really take control of your health and well-being. So stay curious, keep learning, and we'll see you on our next deep dive.